Good afternoon, everyone. If you would, please close that door back there in the back. I'm going to call our meeting to order. This is the Health Subcommittee of Appropriations. We're a couple of minutes late. We're trying to get all our technology working for us up here. We'll have presenters in person, but we'll also have virtual presentation as we go. So I want to thank everybody for coming out. Any of you folks that are standing in the back, if y'all want to find a seat toward the back there, please feel free. You don't have to stand up back there. Get you a chair and make yourself comfortable. Okay. Without further ado, we'll go ahead and get started. First, we're going to hear from the Department of Community Health. Commissioner Nagle is here with us today. Kaylee.
Good afternoon, Mr. Chairman, members of the committee. Thank you for the opportunity to be with you again today. Again, my name is Kaylee Nagle. I'm the Commissioner of the Department of Community Health. We've got several members of our team with us again today. This is Rich Kim, our Budget Director. Ryan Loke, our Chief Health Policy Officer and Deputy Commissioner, is here, as is Brandy Sylvan, Caitlin Ward, and Joe Hood. I'm going to just walk you through the Governor's FY23 from your tracking sheet, which starts on page 26. We'll go through the programs individually, the first being the Department Administration Program. All of these are statewide changes that we have talked about both in joint budget hearing, and probably you'll hear from numerous agencies speak to these. So I'll talk about them in this program, and then we'll just summarize them going forward. $5.1 million in state funds are being added to the budget, starting at 17.1.1. One is $5,000 cost of living adjustment. Again, we are so appreciative to the governor and to the House and Senate support in the amended budget to carry this forward into FY23. I think our agency faced turnover of about 12% in FY21, a little bit higher in 2020, and around 10 to 11% year-to-date thus far. So we know money doesn't solve everything, but it certainly will go a long way into improving those retention rates of our staff. At 17.1.2, $185,000 to increase funds to allow eligible employees to withdraw leave. I think this is a really interesting and creative benefit that I think a lot of our staff will appreciate and take advantage of. $759,000 to reflect changes in ERS, $65 for a TRS adjustment, reduction of $1,000 for DOAS premiums, and $121,000 for TeamWorks billings. You'll see a number of those items repeated, so we won't talk about them in depth, but I'll just summarize them. At 17.2.1, the Georgia Board of Dentistry, these are all statewide changes totaling $61,235. Starting at 17.3.1, the Georgia State Board of Pharmacy, again, all statewide changes for $94,634. At 17.4.1, the Healthcare Access Improvement, also called our State Office of Rural Health, all statewide changes totaling $67,000. At 17.5.1, our Healthcare Facility Regulation Division, again, all statewide changes totaling $3.9 million, most of that towards the $5,000 COLA. There's a number of positions in this program. At 17.6.1 is the Indigent Care Trust Fund. This is $15.8 million. It's a true-up, which will provide for additional Medicaid dollars to be drawn down through matching funds from the state. At 17.7.1, we really get into the meat of the DCH programs, which is our benefit program, starting with Age Blind and Disabled, or ABD. As you may recall, 23% of our Medicaid members are in the ABD program, but it accounts for over 55% of our expenditures. In total in this program, there's almost $165 million in state funds being added, and I'll walk you through some of those. At 17.7.1 is $16.8 million in growth based on projected need. 17.7.2 is almost $75 million to restore FMAP funds. Last year, or in 22, about 1/4 of FMAP savings were reduced from the budget. This is restoring those with the anticipation that the federal public health emergency will be ending and we'll need to restore those funds. 17.7.3 is an adjustment of $45.9 million because of a change in the FMAP rate. This changes periodically and is calculated, I think, on a 3-year rolling average, and so it'll adjust down a little bit, so our state costs will go up. At 17.7.4, increased funds for Medicare Part D clawback, $15.4 million, and the next line item, 10.1, to cover Medicare Part B premiums. At 17.7.6 is the only reduction in this program, which is $638,000 in state funds related to the 2019 RS Means Index for nursing home facilities related to facility improvements over the last few years. At 17.7.7, provide funds for Medicaid reimbursement of clinical trials. I think we talked about this in our amended budget. In December, CMS issued new guidance to states requiring us to cover participation in clinical trials for Medicaid members beginning January 1. So that was included in the amended budget, and this $2.4 million will carry that and continue that into the FY23 budget. And the last two items are yes items, just truing up fund sources. I think we lost our feed. We going too fast for it? Mr. Chairman, you want me to wait a moment or? Keep going? Okay. The next program is low-income Medicaid. In total, $302 million being added to this, and these are, again, 100% benefits. There's no admin baked into this at all. At 17.8.1, it's $20.8 million based on growth. 17.8.2, again, $74 million to restore that 1/4 of FMAP that was removed from the base in a prior year. 17.8.3, again, the adjustment of FMAP from 66.85 down to 66.02, so that'll require $39.5 million more next year. And then 17.8.4 is a similar adjustment for EFMAP of just over $1 million. 17.8.5, we talked about this in the joint hearing, $39 million for the implementation of express lane enrollment, whereby which when children are enrolled in certain SNAP or TANF benefits, their eligibility for Medicaid is also assessed, which should ultimately result in them receiving benefits sooner, and so this $39 million will cover those costs. 17.8.6, the issue that we call attestation, $85 million to correct that. So it'll bring all providers up to the same reimbursement rate for 108 different procedure codes. Right now, between those codes, there's about a $35 average difference between providers that attested in prior years versus providers that have not. And we believe there's about 9,000 providers statewide over many more locations that will be eligible for this increased or enhanced rate. So we're thankful for that add in the budget, and that'll go a long way for our providers. 17.8.7 is the extension of postpartum coverage from 6 months to a year. That essentially is in effect right now with a public health emergency, but once that ends, Georgia's moving, the governor recommended, and I believe there's a Senate bill moving through that will effectuate that in law as well. This $28 million will cover the cost of that extension. That's a great move for the department. At 17.8.8, $11.2 million for the expansion of therapeutic services. I believe it was in last year's budget, DFACS was funded for therapeutic foster care services. CMS came back to us and said they really wanted us to see us as a state expand that to all Medicaid members, not just foster youth, before they would approve it. So this $11 million does that. Essentially, this is an increase in behavioral health aid hours for the students, or for youth with behavioral health disorders or autism. At 17.8.9, provide funds for the Medicaid reimbursement of psychiatric and behavioral health care management service. I think this is about 5 additional procedure codes that will be opened up related to psychiatric case management, I think at $1.5 million, and this comes from a recommendation from the Behavioral Health Reform and Innovation Commission. 17.8.10 is the same clinical trials that we talked about in the other program, $8,000 here, and 17.8.11 is the reimbursement of donor breast milk, which we also talked about in the amended budget, $469,000 for very low birth weight babies. So we're happy to see that provided in the big budget as well. 17.8.12 is a provider fee fund source true-up. In the Peach Care program, a total of $15 million being added, very similar items to some of the other programs. At 17.9.1, $12.2 million increase based on our projected need. 17.9.2, $624,000, which is restoring those FMAP funds that were reduced in a prior year. 17.9.3, again, $2.3 million just to take into account the adjustment in our FMAP rate with Medicaid. The next couple of slides just show, in summary, slide 12 shows a summary by program of all the Medicaid changes within our budget, totaling $498 million just for Medicaid benefits, not administration. In total, $512 million in state funds being added, which would bring our total state funds budget to $4.5 billion. Total funds, inclusive of federal and other fund sources, of just over $18 billion for FY23. I'm happy to answer any questions, Chairman.
Okay, we have a couple of questions. Representative Hawkins, you have a question there?
Good afternoon, Commissioner. Thank you. Can you tell me approximately how many kids we have in Peach Care now?
Not off the top of my head.
Okay.
How many? 190,000. Rich can. 190,000.
Thank you. Thank you.
Commissioner, I want to thank the governor and thank you for this money that is in there for this attestation that we've discussed for years. This is going to go a long way with helping some of our providers be paid a more equitable fee for the services they provide. And thank the governor for putting it in, and thank you for supporting it. I think that'll be very well received.
Thank you.
Let's see, Representative Petrie has a question for you.
Thank you, Mr. Chairman, and Commissioner, thank you for being here. I wanted to tell you a couple of things, but first of all, I wanted to comment on I'm real pleased to see the improvements that relate to the behavioral health type services. It's a huge need in the community, and as we try to deal with autism, as you point out, and I'm really pleased with those couple of budget items you mentioned there. And I also wanted to mention that I just wanted to take note of something and thank you and thank the governor for this. You know, $4.5 billion, you know, a total of what you said, $18 billion now Medicaid program. I think when I got here it was about $11 billion, and that's not been that long ago. But we have dramatically increased the Medicaid budget in this state over the last quite a few years without expanding Medicaid. We are putting more and more money into Medicaid for the people that Medicaid was created for. And we have done that consistently here year after year after year, and I see that again, and it really just, I'm pleased with what I see for whether it's for children with autism or the elderly or, you know, developmental disabilities, all these populations, maternal mortality. This is where we need to improve our Medicaid budget. We continue to do that, and that just makes me very proud. So thank you.
Thank you for your support, sir.
No.
Okay. Anyone else have a question for the commissioner? Okay, you did a great job. Thank you. And
thank you, sir.
Thanks again for your support.
Thank you.
Okay. Next, are we going to be ready for virtual?
Yep.
Okay, next we're going to hear the Georgia Board of Healthcare Workforce virtually. This will be Freeman Montague. Okay, go ahead when you're ready.
Tell me here.
Sorry, we're not hearing you there. Hold on a minute.
I have everything right.
This technology is wonderful when it works, you know. Give us just a minute here. I got my IT person on it over there. Freeman, we're going to put you on hold there for a minute, and we're going to move ahead and go to the Georgia Composite Medical Board, Daniel Dorsey, and he's here with us in the room. Daniel, go ahead when you're ready.
presenting. Is it supposed to be showing up there? There we go. All right. Good afternoon, Mr. Chairman, members of the subcommittee. Thank you for the opportunity for us to present. My name is Daniel Dorsey. For those of you that don't know me, I'm the new executive director. Our former executive director, Ms. LaSharn Hughes, unfortunately unexpectedly passed away in October of last year. So a little bit about us. Mission of our agency is we license physicians and certain members of the healing arts and through an objective enforcement of the Medical Practice Act. So we look into those complaints against those licensees. For our board, we've got about 16 board members. 13 of those are physicians, 2 consumer members, and 1 physician assistant. About approximately 30 staff members, and that includes post-certified agents that investigate those complaints and handle the investigation of those complaints. As a license count, as of January 15th, last month, we have approximately 60,000 licensees that we license in various different professions, majority of which is physicians, but there's the breakdown of everyone that we have licensed. So licensure during FY21, our board processed approximately 6,700 initial applications and renewed over 24,000 licenses. And so as you can see, over the course of that five-year period, we've been issuing more and more licenses. Enforcement for FY21, the board approximately received over 16,000 complaints, and there is a breakdown of the complaints there in various different categories. I know that other category is 495. That is our main category of no jurisdiction. I know it may look weird that other is such a large category, but the vast majority of those are ones that we do not have jurisdiction over. The board's total budget last year was approximately $2.6 million that was appropriated by the General Assembly. And this past fiscal year, we collected about $7.4 million that we turned over to the state's treasury. As far as budget recommendations for FY23, we have 3 recommendations, and they are all statewide. The first one is an increase in funds of $5,000 for cost of living adjustment for all full-time state employees, and that's approximately $193,331. Second recommended change is the increased funds to allow eligible state employees to withdraw up to 40 hours of earned annual leave, and that's approximately $13,759. And third statewide recommendation is a reflected change in the ERS employer contribution, which is around $68,582. And so with those 3 changes, at program net of $275,672, which would bring our state funds of around just a little over $2.6 million. And I'm happy to field any questions and provide more insight.
Okay. Do we have any questions from the committee members? Daniel, what's the difference in a physician and a resident physician?
Resident physician is one that has gone through medical school, and then they're doing their residency training. So it could be like a fellowship or some type of residency training. And so those individuals are not quite at full practice yet.
Okay.
So, and then regular physicians are ones that have gone through all that training.
Right. Okay. Gotcha. Any other questions from the committees or comments? Thank you, sir.
Thank you.
You want to try the Freeman? Okay, we're going to go back to Freeman here.
Can you hear me, Mr. Chairman?
We can hear you now, yes.
Okay, great, thank you.
Yeah, we can hear you, go ahead.
All right, thank you. All right, so there are 6 departments in the Georgia Board of Healthcare Workforce, and there were 3 that the governor recommended changes for FY23. So I'm going to go through those 3 right now. So for 17.11 Board Administration, 17.11.1 was to increase funds, provide a $5,000 cost of living adjustment for all full-time benefit eligible state employees. And this will be effective July 1, and that was for $33,623. 17.11.2 was to increase funds to allow state eligible employees to withdraw up to 40 hours of earned annual leave annually. And that was for $2,549. And 17.11.3 was to reflect a change in the employee's retirement system contribution rate. This was to fund things like the accrual determined employer contribution, provide for cost of living increases for retirees, and increase the employer 401k match, and fund the employer's share of accrued forfeited leave for retiring employees. And that was for $30,349. So the program net was $66,521, which would bring the new amount for admin up to $1,078,652. 17.12 is for the graduate medical education department. 17.12.1 was to increase the funds to reflect an adjustment in FMAP from 66.85% to 66.02%. And the total cost for that was $411,000 and $411,342. 17.12.2 was to increase funds for 136 new residency slots in primary care medicine. And that was for a total cost of $2,534,985. And 17.12.3 would be to provide funds for a pilot program to perform echocardiograms of pregnant and postpartum women to address maternal mortality. That was for $680,000. So the program net for GME was $3,626,327, bringing the total for GME to $28,713,517. And the last of the governor recommended budget changes for 23 was for the Mercer School of Medicine, 17.13. 17.13.1 was to increase funds for the 3rd of the 7-year plan for Mercer's Columbus campus. And that was for $1,073,231, bringing that total to $31,781,025. And so altogether, it's a governor recommended amount of $4,766,079 for FY23. And that's my presentation, Mr. Chairman.
Okay, thank you. I have a question for you. Carolyn, Representative Hughley.
Thank you, Mr. Chairman. Thank you to the Director Montague.
Yes.
Talk a little bit more about your pilot program for echocardiograms for pregnant women. Tell us how many women and what do you expect, or how long it's going to last, and what do you expect in terms of results?
Okay, so I'm not sure if anyone from the Augusta University is actually there in person. This was a recommendation that came from their unit. I have a little write-up that I can also send to members of the board if they, or members of the assembly, if they would like to go through some of the information. I'm sorry, what was your question? Was how many and how long we expected it to last?
Mm-hmm.
Okay, I'm not seeing that here. I may be overlooking. I know they have the cost and a little bit background on basically the need that they have for those rates, but I'm not sure offhand. I would have to get back to you on how long and for how many.
Well, let me just say, I think it's a great program. Part of the reason that mothers die in that first year has to do with heart-related ailments, and I believe this will address that in some way, so we're pleased to see that. I appreciate you.
Okay, we have a question from Representative Buckner.
Thank you, Mr. Chairman. In regards to workforce, and this may be out of sync, but there's been a lot of conversation about mental health and the mental health bill that seems like it's going to pass. And I know from past years, we've had an extreme shortage of psychiatrists in the state of Georgia. Are any of these budget allocations addressing the shortfall of psychiatrists that we have in the state of Georgia? Or do we have any plans to do that in the future when that bill passes?
Well, I believe that we may have some psychiatrists that are in the 136 ask for GME. But outside of that, I don't believe we have any other items that address that.
Okay, may I follow up with one other question? There's also a shortfall of registered nurses in our state, and they are anticipating that to be worse with COVID and the first opportunity for people to retire after this all settles down. Are there some programs throughout the state that are trying to figure out how to do that in a faster fashion but still provide quality nursing? And is that included in any of these education programs?
Well, as of now, it's not included in any of our recommendations. I would have to follow up to see if we have any other resources that I could better address your question of if their programs work at a faster rate. I'm not aware of any right now I could give you.
Okay, thank you.
Representative Petrie has a question.
Thank you, Mr. Chairman. And Mr. Director, my question was similar to one that was just asked. I was concerned about our nurse shortage, a real crisis in this state today. And we just did in the supplemental, supported a pilot program at Grady, which I was thrilled to see. And I hope that there's a very real recognition that we've got to continue to make sure that we provide every opportunity we can to turn out more nurses in this state.
Yes, sir. Thank you. We'll take that into consideration. Thank you for that.
Thank you again, Mr. Chairman. Mr. Director, we heard earlier this year that there's a shortage of forensic scientists, and there is a program at Albany State University, and several of those students graduated and they didn't have any opportunities, but yet the state says that we're short. Are you all working with that program at all to try and marry up those two entities?
I'm not aware of which program in particular you're talking about. You said there's one in Albany that addresses forensic pathologists.
This is for forensic pathologists that they are
Right.
saying that we need. There was a program for that at Albany State University, and I mentioned that because I have a young lady who graduated that program, could not find any jobs. She's a teacher. She's a science teacher now, but we need her in her career path, and I was just wondering if maybe you, or I don't know which entity we need to ask to check on that to try and marry up that program with the need that we have.
All right, well, I can certainly look into it.
Thank you.
Okay, we had some money in the budget last year to work with the forensic pathology program over at Mercer, and they were not able to fill those positions, but they're still working on that, and that's a big need according to what we're told by GBI and others, and you're right, there's a real need, so we need to do whatever we can to help with that. Okay, any other questions or comments from anybody? Thank you very much.
Thank you.
Okay, next we're going to hear from Dennis Trotton. He's the director for the Georgia Drugs and Narcotics Agency.
Good afternoon, Mr. Chairman and members of the committee. Appreciate your having me over. I'm sorry I'm doing an old-fashioned thing here. I gave paper to you, so it's not a lot of paper either, so I'm showing my age a little bit there. So just a quick overview of us. Submission of GD&A, that's us, the Georgia Drugs and Narcotics Agency. Protect the health, safety, and welfare of the public by ensuring all of the laws pertaining to pharmacy, prescription drugs, and controlled substances are followed by both registrants and any others who handle and possess prescription drugs. As the enforcement arm of the Georgia Board of Pharmacy, we inspect all pharmacies in the state. Agents conduct investigations of these pharmacies related to public complaints and administrative issues. They also conduct criminal investigations regarding prescription drug abuse throughout the state, which may or may not involve these licensed pharmacies. There are approximately 47,600 active licensed registrants with the Georgia Board of Pharmacy. This includes the licenses of pharmacists, pharmacist interns, pharmacy technicians, retail pharmacies, hospital pharmacies, drug researchers, drug wholesale distributors and manufacturers, non-resident pharmacies, and durable medical equipment providers. GD&A is responsible for conducting the inspections and investigations if needed for all of these facilities. In FY21, with 10 agents, all of whom are registered pharmacists and post-certified police officers, we conducted 2,621 inspections of Board of Pharmacy licensed facilities. This is the fourth consecutive year in a row that we've had an increase in those, so I'm incredibly proud of my agents for, even during COVID, we made sure we were doing our job and in these facilities to hopefully make sure things were going proper and pharmacies were doing the right things. Agents completed 414 administrative and criminal investigations. Agents also review, if necessary, and investigate all applications that are submitted to the Board of Pharmacy requesting a facility license. And in FY21, the board issued 658 facility licenses for which GD&A, our agency, did those reviews of those applications. As far as our budget, it's essentially the three that everyone has mentioned, are the smaller agencies. The increase to cover the cost of living, and I'm using y'all's tracking sheet, that's 17.18.1, that's $109,274. The second item was increased funds to allow that withdrawal of the 40 hours of annual leave, $18,417. 17.18.3, change in the employee retirement system, and that's $88,229 for a total change of increase of $215,920. And I'm glad to answer any questions I can.
Okay, do we have any questions for the director? Yes, ma'am, sure. Representative.
Thank you, Mr. Director. With the inspections that you do, what is your typical finding?
Incredibly varied, because we go into every type of pharmacy, like the ones you go to, right, to get your prescriptions, but then every hospital, nursing home pharmacies. And what we're looking for when we do that is that these pharmacies are following the basic rules and laws of the state. Huge interest in record keeping, keeping the proper records, and that includes everything from that patient information to exactly how many drugs they purchase and exactly how many go out the door. And so we focus on that area as well. But then we also, the investigations we do, all the complaints that come into the board, and some are as simple as, thank goodness we don't get too many, my pharmacist was rude. He was ugly and spoke too loud about my medicine.
Did they talk about you?
Well, that's a...
Not him.
Well, as I say, I'm not saying he named anything. But then up to divergent impaired pharmacists, those impaired physicians, nurses, we work those cases as well. So you don't have enough time to hear all the things that we see out there, but that it's basically anything to do with prescription drugs is what we can investigate and do investigate.
Well, we can assume that our pharmacist is doing a pretty good job then, huh?
The vast majority, yes, ma'am. The vast majority are doing a great job out there, especially during this pandemic.
Yeah. Thank you. Director, I have a question for you. You've got 10 agents. Is that are you full, or do you have vacancies, or?
I actually have, right now I've got 10 full-time, 1 part-time. And so my Southwest Georgia territory, we break it up by geography and around the state. So I do actually have the need for 1 more that left me last year, but those are the total funded positions that I have are 10 full-time
So you have 10 funded positions, and they are at the moment filled, right?
Well, I've got one opening for one of those, yes, so I've got 9 full-time.
And I think it's important to point out that these agents are both pharmacists and post-certified.
Yes, sir, we have to maintain our, as I am, been a pharmacist for, well, too long, but, and all our agents, yes, sir, are also post-certified police officers.
Right. Okay. Any questions or comments from the committee? Thank you.
All right, thank you, folks.
Okay, next, Commissioner Nagle.
Thank you, Mr. Chairman, Committee. It's nice to be here in person and see you. Before I start, I wanted to say that I was severely criticized for not introducing my staff when I began the last 2 budget hearings. And I want to especially introduce Will Bell, who's our new CFO. We're just really delightful person, and we are just delighted to have him helping us. And also Megan Andrews, who I'm sure many of you know, who's our Deputy Commissioner for Policy. So thank you both for your assistance throughout the budget preparation. I was going to start very quickly with the picture I always start out with, because our agency is so different than every other agency in that we have a state office, 18 districts that are run by a district health director who are state employees and state staff, but also 159 county health departments that are Board of Health employees. So they're not state employees, but they are supervised by the district health directors who are state employees in a hybrid type of role. And as we go on to the statewide change items and the governor's recommendation, I wanted to highlight that we, like the other commissioners outlined, have gotten those same additions from the governor's recommendation, and we're just very, very grateful for those increases. But I particularly want to point out the $5,000 increase for full-time benefit-eligible state employees. If you look on the next page or in the next slide, you'll see line 3812.1, public health formula grants to counties. So that funding will actually allow us to do that $5,000 increase, not just for state employees, but also for the Board of Health employees. And we are just so very grateful for that. The pandemic has certainly stressed every agency, but our agency uniquely. And many of our key staff, particularly epidemiologists, nurses, as well as our environmental health inspectors, are underpaid, but have worked really extraordinary hours during the pandemic. And so this is going to be of extraordinary benefit to us. We had a big turnover of staff, both in nurses and even environmental health inspectors. 21% of our inspectors left. And just this $5,000 pay increase will be a 10 to 11% increase in salary for these staff. And so we're really grateful to the governor for supporting this increase for our key program staff throughout both the districts, state districts, and the counties. Going on to the next item, I wanted to just spotlight some of these programs that are also receiving an increase. You've heard some of these before, so nothing is going to be really new to you. 38.1.4 is a pilot program for comprehensive care management for high-risk pregnancy populations. This is $500,000 proposed as a contract with AU, so MCG at Augusta University. And it's to address, again, the issue of maternal mortality. And we're very interested to see how this is going to unfold. The idea is to identify high-risk mothers, both prenatally and postpartum, and to be able to monitor them remotely by providing them with the equipment to transmit their blood pressure and other indicators, as well as communicate with a patient navigator. And so we in public health will be working closely with them, initially starting in the Augusta area and hopefully expanding to statewide in partnership with AU. The Georgia Coordinating Center, that's 38.4.5, is again something you are familiar with. We had originally stood up the coordinating center at Grady when Grady had a pipe burst and lost several floors of capacity. And we had a difficult time being able to direct ambulances to appropriate hospitals because of the lack of capacity in the metro area. Now, this was in 2019, just a few months before our first COVID cases. But then when COVID came, we realized that this model was actually very, very useful, and the coordinating center, which was funded at about $1.7 million, allowed us to do that coordination in the metro area very, very effectively around COVID, particularly as the cases increased. But we also recognized that we needed a similar type of program statewide because all the hospitals were having capacity issues, and we needed to be able to direct the EMS providers to the appropriate hospital where the appropriate care could be given. And so this additional $4.3 million will fully fund the coordinating center to allow us to have a statewide approach to coordination of care in all statewide hospitals. And I think it's really going to have a big impact, not just on things like COVID, but also trauma, stroke, other kind of high-intensity conditions. 38.9.4, the AIDS Drug Assistance Program. Again, this is something that we talked about in the this year's budget. The $9.9 million is again needed to make that state match, to allow that state match to be fully fulfilled, and to allow us to continue to grow the program appropriately. And we went through, I think earlier, the reason why there's increased demand on this program, both with an increased number of cases, also because of the pandemic, increased need because of lack of insurance, but also recognizing that we're doing a better job of identifying individuals with HIV and putting them on care can actually reduce transmission and reduce the number of cases. And so this will make the program whole. This will be a continuation. And we see this as really an extraordinarily important aspect of our budget to continue with our prevention and care of HIV patients and not have to initiate a waiting list, which would be devastating, and potentially increase our HIV rates. And the final 38.9.5 is the final tranche of funding for a 3-year pre-exposure prophylaxis program. It's a pilot program. It was initiated in Towns and Haralson County to provide PrEP or pre-exposure prophylaxis to stop the transmission of HIV before it occurs in individuals who are at high risk. We have not really fully developed this program, this pilot, which we had hoped would be a model for the whole state, particularly in rural areas, because of the pandemic. Staff were diverted to other things. And so this last tranche will allow us to fully develop the program, get that information about how to roll out a rural program, and particularly this population, which is at risk because of drug use. And we hope that we will use that as a model to expand PrEP services in other parts of the state afterwards. And that's the end of our budget presentation. I would be delighted to answer questions.
Thank you very much, Dr. Tim. We have a question. Representative Taylor has a question for you.
Thank you, Mr. Chairman. This is actually not a direct question on this budget, but it made me think of our past budgets. And I really wanted to commend you on what the department has been through in the last several years and how your folks have managed. It was a uphill battle, to say the least, and I wanted to just thank you for all that you were able to accomplish and do for the people of Georgia. Thank you.
Oh, thank you so much, Representative, and just so many thanks to the staff throughout the state. They have just done a great job. I'm very proud of them.
And thank you, Commissioner, and let me begin by just thanking you for all your work throughout the pandemic. You have made us all proud, and we're proud of you. I wanted to ask you, so the really like what I'm seeing here, this yet again another pilot in the Augusta area as it relates to high-risk pregnancy. My question is, we also heard earlier about a program related to a cardiac-focused program. So are y'all collaborating in that? Is that the goal, that this is all collaborative, I assume?
No, that's really, that's a very important question, because I wasn't fully aware of that other program.
Oh, okay.
But it's actually the same individuals at Augusta University. And now that we know about it, we can ensure that we actually maximize the impact of both those programs, because although they're doing different things, they're in some sense reaching out to the same high-risk individuals, both prenatally and postpartum, to ensure that 1 year postpartum, that high-risk year, is healthy for the mothers. And so we will certainly, if funded, we will certainly ensure that we work out that collaboration both with the AU staff, Dr. Chad Ray, who's the one with whom we have been working, and our nursing staff who are working on prenatal care.
Well, thank you for that collaborative effort. I hope that we, hopefully we'll get some real good information and have learned a great deal from this.
I think so as well, and it can leverage the work with our perinatal centers as well.
Okay, Representative Buckner has a question.
Thank you, Mr. Chairman. I too I do thank you for my years in public health and all my friends there, and the hard work that you've done through COVID. I had asked this earlier in another meeting. I wonder if there is a way that we could find out a little bit about the pay scale for public health workers that we are paying compared to market rates for those same job classes. I'd just like to know how far off base we are. And you can provide that later. You don't have to tell me now, but I'd like to have that information. And then the other thing, I was told just in passing, and I didn't get all the details, that there's some special program or study that's being done on lead poisoning. And I was wondering if that was something that's funded privately, or is that a project that will require some funding from us?
You know, the lead intervention on the part of our staff will require a small amount of funding for our environmental health inspectors. Any fees won't sufficiently fund that. And I think there is a fiscal note attached to that bill that was heard in committee today.
Okay, thank you.
Thank you, ma'am.
Thank you, Mr. Chairman. It's not a question, just a comment, public comment. I want to thank you for all you've done for this state. All the times you and I talked late at night, before and during and after COVID, I could hear you smile on the end of the phone. And actually, I felt better after discussing things with you. So I just want to publicly thank you for helping all of us. Thank you.
Thank you, sir.
Representative Hughley, you had a question.
Thank you, Mr. Chairman. I want to extend my thanks as well, particularly for the workers in Columbus. They really went above and beyond, and I'm sure they've done it all over the state. I was curious about the staffing and how far off we are, and Representative Buckner already asked that question, so if you would share that with me as well.
Yes, ma'am.
Do we have any other questions from the committee? Anybody? Dr. Timmy, thank you very much.
Thank you so much.
Okay. Next and last on our agenda today is the Georgia Trauma Commission, Liz Atkins.
Good afternoon. Thank you, Mr. Chairman. Do you need my? Okay, great. Thank you. Good afternoon, Mr. Chairman and members of the committee. Thank you for having us present on our FY23 budget. And this is the first year that we'll have the full allocation for the super speeder funding through the trust. So I have just prepared a one-pager since we're last to go in the agenda, and just kind of highlighting for you the buckets of where our funding goes. And essentially, they're the same typically as they are year over year. What is a little bit different this year is, since we will be getting a little bit more of the funding up front, is that we've sort of coalesced what would normally be an amended budget into this budget. So I'll talk about that briefly, but you'll see at the top is just commission operations, and that's really us, the staff, and the infrastructure for our staffing. And then with system development, access, and accountability, that is a sum that is the result of distributions throughout each of Georgia's 10 EMS regions for coordination of activities in those regions to drive performance improvement. In addition, this is the funding that goes towards our national benchmarking that helps us look at outcomes for citizens, for injured citizens across our 33 trauma centers. We also have an annual allocation that goes to the Medical Reserve Corps, part of MAG, and they were very integral in exercising and standing up units in support of COVID. And they do a lot around emergency response education throughout the state, which is very supportive for trauma. And then our Georgia Quality Improvement Program, which again is the infrastructure around that national benchmarking piece that I alluded to, which is really the data-driven outcomes, the things that you all want to hear about. How is the funding really impacting the bottom line of outcomes? And then injury prevention. So that's actually mentioned in the code that established us, but due to funding, from year to year being a little bit variable, we didn't really have a whole lot to invest in injury prevention. So we look forward to being able to put more in that bucket in the future. And then the Georgia Trauma Foundation, again, according to code, we establish, oversee, and maintain the foundation. It's undergone some leadership changes over the last year, and we look forward to really ramping up some of the fundraising efforts for that entity to really get it ramped up. And then by code, we give up to a maximum of 3% of our funding to DPH, Office of EMS and Trauma. So that's the allocation there. And then the balance of that, we divide up between the trauma centers, and you all have heard in the past how we break that down to readiness and uncompensated care and registry support funding, as well as for EMS stakeholders. And that typically, EMS stakeholders, we fund an automatic vehicle locator system, which lets us have the ability to know where every 911 response ambulance sits in Georgia, so that if there is a need for patient movement, for example, evacuation from like a coastal area of Georgia or such, we would know where all those assets sit and be able to act on that, as well as some ambulance equipment grants. Back in the day, we used to fund ambulance replacement grants as part of uncompensated care, but that's shifted a little bit, and that's based on what the stakeholders themselves voted, that they would like to have equipment grants. So that's sort of how we handle that. And that's kind of a very high-level overview of that, and I'm happy to take your questions. And with me today, I actually have my chairman sitting in the back row, Dr. Dennis Ashley. He was here for another presentation earlier today, as well as our finance officer, Katie Hamilton. So we'll take your questions.
Great, thank you. I have a question from Representative Buckner.
Yes, ma'am. I'm just curious, under the injury prevention, does that include funding for Safe Kids, those coalitions and organizations across the state?
Yeah, that's a great question. So right now, it does not specifically include Safe Kids, but what we would like to do is identify some of those partners, like Safe Kids, and let them tell us what is the best way to spend that money, and potentially create grant funds where we can take applications, we can pull the right stakeholders in to evaluate those applications, and then where's the best place for the money to go. It's really, we're kind of just on the edge now, because we're going to have the funds to be able to do that. So now the work is up to us to figure out how can we partner with key stakeholders like that to get the money out there to make it maximize it, do the best for it.
Thank you.
Thank you.
Thank you, Chairman. The formula, so when you look at, obviously, and the good news here, overwhelmingly, this is going to support the trauma centers. Can you explain real high level, no, not too detailed, exactly how the formula you use to determine where those funds go?
Right, between the trauma centers, yeah.
Between trauma centers, yes.
Thank you for asking high level, because
Yeah, I don't want you to get into too much
we've
minutia.
spent a lot of time in the weeds with that. So high level, we take a stipend for the lower level centers. There's 4 levels of trauma centers, level 1, 2, 3, 4. So the 3s and 4s are funded at what we call stipend, which is just kind of off the top. And then from that, the trauma centers are funded at the highest, the level 1 centers are funded at the highest level. The level 2s are 60% of that level, and the burn centers are 50% of that level, of what the level 1s are at. And I'm happy to say that we've done some, now that we just did a readiness cost survey for the level 3s and level 4s, we've actually done a preliminary crunching of that number, and what the readiness costs are to our percent is actually pretty on target for what we, you know, the data that we can have. It's not perfect data, but it's the best we can get. And we're trying to optimize it every year that we do a readiness cost survey. And we finally do have readiness costs for level 3 and level 4. We're really happy about that, because that'll help us figure out, with this additional funding through the trust every year, how can we recruit level 3s and 4s? We're not likely to recruit more 1s and 2s, but we really need those 3s and 4s in the rural areas. So thank you for that question.
Okay, any other questions? Thank you.
Thank you,
Appreciate
Mr.
being
Chairman.
here today.
Thank you, committee.
That completes our agenda. Just want to, first of all, thank Director Atkins and all the other presenters that were here today for the job that they've done throughout these past months with COVID and everything else that we've had to go through, helping to take care of the folks in Georgia and trying to keep us all safe and healthy. Just to remind the committee members, tomorrow at 1 o'clock in this room, 341, we'll have our second meeting, and this will be an opportunity for public input from those who are interested and want to come and testify before the committee. And at 12:45, Tara will be here with a sign-up sheet for anybody who wants to speak. They can come and sign up at 12:45 so that we can be ready to begin the meeting at 1 o'clock. So it'll be 1 o'clock tomorrow in this room. Any comments or observations from the committee?
I love the fact that they're in order of the speakers. Thank you, Tara.
All right, we'll adjourn. Thank you very much for coming.